Been there. So technology, I think that's what Sandra's doing, because but as a result of reading her obscurely difficult bio, I started reading about technology, digital technology that actually helps us through our everyday lives, and how interesting they are. These technologies, digital technologies, are becoming as helpmates, personal helpmates to us. And I was reading about this app that you can now will be able to buy for $4 that is built to improve your mood. And it's all through dialogue with the app and the computer, and it's a personal conversation, because we all have those terrible days, and we all feel really badly so many times, and technology is probably half the cause of it. And so, and this one is like, it's about speaking to me. So can you tell us about what this obscure thing that you're doing is, and why we should care?
So, so I work for HIMSS, the Health Information Management Systems Society. Our organization's mission is to perpetuate better health and health care through the optimization of healthcare technology. If you went to a physician's practice 10 years ago, chances are they weren't on an electronic medical record. There wasn't a computer in the exam room, and they had a paper chart that they were writing notes on as they spoke with you. Fast forward to today, your physician is likely to get alerts about bad test results on his phone at his home. So the advancement of communication and how we process things and how we expect our physicians to process things at the speed of light has a tremendous impact on how healthcare is delivered. And what we are finding, so interoperability initiatives is a deceiving word, right? It's connectivity, right? It's about getting the right information to the right place at the right time. So I specialize in that. I started out at Ohio Health years ago, and as an interface analyst, and I was responsible for a phenomenal hospital that Roz was responsible for all the design work on. I was responsible for building those clinical interfaces. And the idea was to build this paper-light hospital. The president of this hospital, it's so reminiscent of this conversation, is it not?
The word that comes to mind is vision keeper.
Yes, vision keeper, absolutely. And she said...
a nurse, she was a nurse.
She was,
Cheryl Herbert is a nurse.
Okay, yeah, so she was the president of this hospital, responsible for all the buildup of a hospital from scratch. And she wanted it to be paperless. And she wanted it to be quiet. There to be no overhead announcements. And there to be lots of light, which we take all this for granted. Now, walking through these facilities, it's not happened easily. And I think, you guys certainly know that way better than I do. But I can remember being on this project and listening to this woman say, we're not going to have a paper, and just thinking, how are we going to make this happen? And it's going to be quiet. Well, no, we have overhead systems and call systems, nurse call systems, and all. How are we going to overcome these challenges? So I got to be part of that amazing project. And the biggest hurdle that we had to overcome was having systems that didn't talk to each other. Another thing that you all probably take for granted is that your bank is following standards that are going to keep all of your information private, and that it's all going to be, if you fly to China, you can use your debit card without a problem. If you fly to China and go to the emergency room, do you think your electronic medical record information is going to be there? It's not. And if you're incapacitated and the physician doesn't know what your allergies are and they're treating you, you could die. So that's a problem. So interoperability is a passion of mine, and helping these systems connect so they can get the right information to the right place at the right time is a passion of mine. And so I'm honored to be here with you all. I know of your wonderful, wonderful work. I told Roz, I said, after building those interfaces, was responsible for physician practice integrations. And we went back to the well on, we must have gone to Dublin Methodist Hospital to scope out how they had done it 100 times in just a few years. So it's just exciting to be here, and I just hope that I can lend you guys some maybe insight as to how the decisions that you all make have these underlying necessities in technology that are incredibly important. And there's a lot happening. I think that as we try to shift the accountability more to providers first and now to the patients in the form of wearables that report data about your health care. There are tons of health plans out now that are paying, basically your premium is related to, can you run a mile in under 8 minutes? Can you, what's your blood pressure look like? You can save a ton of money if you're taking care of your body. And this is all able to happen because there is connectivity and interoperability of the technology that's being used. So
So I.